Okay, we're starting with the brachiocephalic trunk, which just left the aortic arch, and we follow the blood towards the right subclavian, and it splits on further into the left common carotid, which we also can see here going up to the top, and the last split is in the left common carotid, going up also to the other side towards the head. We can see the split of the internal or external carotid. The thoracic duct would be visible underneath here, and it might be in this area. Then following our brachiocephalic parallel down from the aortic arch, we also have the left subclavian artery coming out, which go into the axillary artery and then into the brachial artery. And you can tell the difference because we can see here a lot of these whitish lymph nodes directly visible. Now if you want to follow the blood back, we start with the brachial vein, going into the axial vein, into the subclavian vein. The subclavian vein together with the external jugular coming from the head go into the brachial vein. The brachiocephalic vein, sorry. Brachiocephalic vein is a small little piece here, is for the left side, and then on the other side, as you can see, we have the same arrangement. We have like a very small brachiocephalic, and then we see here to the side going into the right subclavian, and then we have here going up the right jugular towards the head. Down here, the parallel in the brachiocephalic, we have the superior vena cava. Now, if we turn down to the other side, further down, we can see below the kidneys, it's not freed up here totally, but we can see here the renal vein. To dig a little bit deeper, there's the renal artery. Then below the inferior vena cava, we also can see our abdominal aorta. The abdominal aorta is splitting up, and you can see nicely split into the external, right and left external iliac artery. Then it continues, I don't know if you can see that on the camera, it continues down into the internal. These are the lower ones. This would be the internal iliac artery. When we follow the flow past the iliac, so like here they open this nicely, so if you go behind on this side, we have the external iliac reaching into the femoral artery, into the leg. Coming back is the great saphenous vein, which continues and then merges together, keeping going as a femoral vein. The femoral vein comes out, goes into the external iliac vein. Here we have a common one, but we probably cannot see it all the way. Let me see if I can make it visible. No, we can't see it. We just have here the inferior one. Then we have also the spleen. We have the ileocecal lymph nodes. We have here some of the inguinal lymph nodes, these whitish kind of things. And then we also have the axillary lymph nodes and the submandibular lymph nodes. The thymus, part of the lymphatic system, is lying here on top.